Which of the following is the most common surgical procedure for chronic otitis media? Option A, myringotomy. Option B, ossiculoplasty. Option D, mastectomy. Option D, tympanoplasty. The common surgical procedure for chronic otitis media is the correct answer. Option D, tympanoplasty. Tympanoplasty is the surgical reconstruction of the tympanic membrane to restore hearing and prevent recurrent infections. It is commonly performed for chronic otitis media to repair perforated eardrums and improve middle ear function. The next question. Nurse is caring for a client who is thought to have pernicious anemia. What signs and symptoms would the nurse expect in this person? Option A, easy bruising. Option B, beefy red tongue. Option C, fine red rash on the extremities. Option D, pruritus. And the correct answer is option B, beefy red tongue. Pernicious anemia is a type of vitamin B12 deficiency anemia. A characteristic sign is a beefy red, smooth and sore tongue. Other symptoms may include fatigue, weakness, pallor and neurological manifestations. The next question. The nurse is to administer an IM injection to a 6-month-old child. What is the most appropriate site to use? Option A, varus laterales. Option D, dorsal gluteal. Option C, ventral gluteal. Option D, iliac crest. The most appropriate site to administer IM injection is option A, vastus lateralis. For infants and young children, the vastus lateralis muscle is a preferred site for intramuscular injection due to its size and distance from the major blood vessels and nerves. The dorsal gluteal site is avoided children under 3 years due to risk of sciatic nerve injury. Next question. The nurse administers iron using the jet track technique. What is the primary reason for administering iron via jet track? Option A, to prevent adverse reaction. Option B, to prevent staining of the skin. Option D, to improve the absorption rate. Option D, to increase the speed of onset of action. The correct answer is option B, to prevent staining of the skin. The jet track technique is used to prevent leakage of the medication into the subcutaneous tissue, which can cause irritation and permanent staining of the skin. This technique involves displacing the skin and subcutaneous tissue laterally before injection and releasing it after the injection. The next question. The nurse is administer a tuberculin skin test. What is the correct procedure? Give it subcutaneously in the inner aspect of the forearm. Use a 21 gauge needle administered in the forearm. Give it at a 10-degree angle in the polar surface of the administered it intradermally. The correct answer is option D, administered it intradermally in the upper arm. The tuberculin skin test is administered intradermally, typically on the volar surface of the forearm. A small amount of purified protein derivative is injected just beneath the skin surface, forming a wheal. The test is read within 48 to 72 hours. Isolation of a child with measles belong to what level of prevention? Option A, primary. Option B, secondary. Option C, intermediate. Option D, tertiary. Option A, primary. Option B, secondary. Option C, intermediate. Option D, tertiary. The correct answer is option B, secondary. Secondary prevention involves early detection and intervention to prevent the progression of disease. Isolating a child with measles is a secondary preventive measure to prevent the spread of infection to others. Isolation a child with measles is a secondary preventive measure to prevent disease. Which immunization produces a permanent scar? Option A, DPT. Option B, BCG. Option C, measles vaccination. Option D, hepatitis B vaccination. The immunization produces a permanent scar is, the correct answer is option B, BCG. The BCG vaccine given for tuberculosis often result in a permanent scar at the injection site. This is a characteristic feature of the vaccine. BCG given for tuberculosis and often result permanent scar at the injection site. Next question. Which of the following disease is airborne? Option A, viral conjunctivitis. Option B, acute poliomyelitis. Option C, diphtheria. Option D. Which of the following disease is airborne? Option A, viral conjunctivitis. Option B, acute poliomyelitis. Option C, diphtheria. Option D, measles. The correct answer is option D, measles. Measles is a high contagious viral infection transmitted through respiratory droplets and is considered airborne due to its ability to remain suspended in the air for extended periods. The next question. The nurse is caring for a patient who has just undergone thyroidectomy. What is the most important assessment to make during the immediate post-operative period? Option A, monitor for signs of hypocalcemia. Option B, assess for signs of hypothyroidism. Option C, check for signs of infection at the surgical site. Option D, monitor for sign of hypothyroidism. The correct answer is option A, monitor for signs of hypocalcemia. After thyroidectomy, especially if the parathyroid glands are inadvertently removed or damaged, there is a risk of hypocalcemia. Symptoms include tetany, numbness and tingling around the mouth. Which of the following is a common side effect of opioid analgesics? Option A, diarrhea. Option B, hypertension. Option C, constipation. Option D, tachycardia. Which of the following is a common side effect of analgesics? Option A, diarrhea. Option B, hypertension. Option C, constipation. The correct answer is option C, constipation. Opioid analgesics can cause constipation by decreasing gastrointestinal motility. Patient on long-term opioid therapy should be monitored and may require laxatives or stool softeners. Next question. A patient is receiving a blood transfusion and begins to experience chills, fever and back pain. What is a nurse priority action? Option A, slow the infusion rate. Option B, stop the transfusion immediately. Option C, administer acetaminophen. Option D, notify the healthcare provider. The correct answer is option B, stop the transfusion immediately. These symptoms may indicate transfusion reaction. The transfusion should be stopped immediately and the healthcare provider should be notified. The patient's vital signs should be monitored and appropriate interventions should be initiated. The next question. Which of the following is the most appropriate action when administering a medication via nasogastric tube? Option A, crush all medication and mix with water. Option B, administer each medication separately with water in between. Mix all medication together in a large volume of water. Administer medication without flushing the tube. Correct answer is option B, administer each medication separately with water in between. To prevent drug interactions and tube occlusion, each medication should be administered separately followed by a flush of water. This ensures that each drug is properly absorbed and reduce the risk of complication. The next question. Which of the following is a contraindication for the administration of MMR vaccine? Option A, pregnancy. Option B, recent antibiotic therapy. Option C, mild cold symptoms. Option D, history of chickenpox. Pregnancy, recent antibiotic therapy, mild cold symptoms, history of chickenpox. The correct answer is option A, pregnancy. The MMR vaccine contains live attenuated viruses and is contraindicated during pregnancy due to potential risk to the fetus. Women should be advised to avoid pregnancy for at least 28 days after receiving the vaccine. The next question. A patient with chronic obstructive pulmonary disease is receiving oxygen therapy. What is the nurse's primary concern? Option A, oxygen toxicity. Option B, risk of infection. Option D, hypoventilation. Option D, dry mucous membrane. The correct answer is option C, hypoventilation. In patients with COPD, oxygen therapy can suppress the respiratory drive leading to hypoventilation. Oxygen should be administered cautiously and the patient's respiratory status should be closely monitored. Next question. Which of the following is the most appropriate intervention for a patient experiencing seizure? Option A, restrain the patient to prevent injury. Place a tongue depressor in the patient's mouth. Position the patient on their side with the head flexed forward. Administer oral glucose immediately after seizure. The correct answer is position the patient on their side with the head flexed forward. Positioning the patient on their side help maintain a patient airway and prevent aspiration. The head should be slightly flexed forward to allow any secretion to drain. Restoring the patient or placing object in the mouth can cause injury. Next question. A patient is scheduled for a colonoscopy. Which of the following is the most important pre-procedure instruction? Option A, maintain a low fiber diet for 3 days prior to procedure. Take a laxative to the evening before the procedure. Clear liquids only the day before the procedure. Avoid all the medication for 24 hours before the procedure. The correct answer is option C, drink clear liquids only the day before procedure. To ensure a clear view of the colon during the procedure, the patient should consume only clear liquids the day before and follow any additional bowel preparation instructions provided by healthcare provider. Best method to prevent nosocomial infection. Option A, use gloves only. Option B, hand hygiene. Option C, mask alone. Option D, antibiotic prophylaxis. Option A, use gloves only. Option B, hand hygiene. Option C, mask alone. Option D, antibiotic prophylaxis. The correct answer is option B, hand hygiene. Hand washing is the most effective infection control measure. Hand washing is the most effective infection control measure to prevent nosocomial infections in the hospital. Hand washing or hand hygiene is the most effective method. Nurse is monitoring a patient for shock early sign. Option A hypotension, option B tachycardia, option C cold extremities, option D confusion. Option A hypotension, option B tachycardia, option C cold extremities, option D confusion. The correct answer is option B tachycardia. Compensatory mechanism hypotension occurs later. Early sign of shock is tachycardia. Compensatory mechanism hypotension occurs later. Then next question. Most appropriate needle size for IM injection is option A 18G gauge, option B 22 gauge, option C 25 gauge, option D 27 gauge. Option A 18 gauge, option B 22 gauge, option C 25 gauge, option D 27 gauge. The correct answer is option B 22 gauge. 22 to 25 gauge is standard for IM injections in adults. 22 to 25 gauge is a standard for IM injections in adults. The next question. First step in CPR for an adult. Option A start chest compressions, option B check responsiveness, option C call for help, option D open airway. Option A start chest compression, option B check responsiveness, option C call for help, option D open airway. The correct answer is option B check responsiveness. Determine consciousness before initiating CPR. First step in doing CPR is check responsiveness. Determine consciousness before initiating CPR. The next question. Common symptom of dehydration in children. Option A edema, option B sunken eyes, option C polyuria, option D hypertension. Common symptom of dehydration in children. Option A edema, option B sunken eyes, option C polyuria, option D hypertension. The correct answer is option B sunken eyes. Sunken eyes indicates fluid loss. Monitor vital signs. Common sign of dehydration in children is option B sunken eyes. It indicates fluid loss. Monitor vital signs in children. The next question. Best position for the patient with respiratory distress. Option A supine, option B Trendelenburg, option C semi-flower, option D prone. The correct answer is option C semi-flower. It improves lung expansion and oxygenation. The correct answer is semi-flower. It improves lung expansion and oxygenation. The best position for patient with respiratory distress is semi-flower. It improves lung expansion as well as oxygenation in patient with respiratory distress. Next question. Which IV fluid is isotonic? Option A 0.45% sodium chloride, option B 0.9% sodium chloride, option C 5% dextrose in water, option D 3% sodium chloride. The correct answer is option B 0.9% sodium chloride. Normal saline is isotonic, maintains fluid balance. Normal saline is called isotonic solution that maintains fluid balance. The next question. Hypoglycemia sign. Option A polyuria, option B polydipsia, option C tachycardia, option D usmal respiration. Option A polyuria, option B polydipsia, option C tachycardia, option D usmal respiration. The correct answer is option C tachycardia. Hypoglycemia may cause sweating, palpitations and tremors. Tachycardia is a sign of hypoglycemia. Hypoglycemia may cause sweating, palpitations and tremors. Then next question. Pre-procedure instruction for colonoscopy. A. Low fiber diet 3 days prior. Option B. Take laxative evening before. Option C. Clear liquids only day before. Option D. Stop all medications 24 prior. The correct answer is option C. Clear liquids. Ensures colon visibility during procedure. Ensure colon visibility during procedure. Thank you all.